Hello, everyone, and welcome to week 12. This week we will be discussing language and communication. My name is Vanessa, and I will be joined by Guadalupe and Genesis. While viewing this PowerPoint, there are a couple of questions to keep in mind. The first one is, in which ways can disruptions in language acquisition impact a child's development? Secondly, we'd like to focus on what might be indicative of an atypicality in language acquisition. Lastly, what are some ways to assess for delayed or impaired language and communication acquisition?
I summarized the chapter this week based on the learning objectives that can be found on page 212 of the textbook. The first objective talks about the four major systems of language and examples of research methods that are used to study language development in these four systems. The four major systems of language are phonology, which is sound patterns of language, semantics, which is meanings of words or signs, grammar, which is systems of rules for combining words or signs, pragmatics, which is using language for specific purposes in specific social contexts. An example we have is the intermodal preferential looking procedure, also known as IPLP. And this research method shows infants two side-by-side videos and hear a word or linguistic stimulus that matches one of the displays. Infants who understand the linguistic stimulus look longer at the matching video than the non-matching video. This study has been used since the 1980s to study preverbal infants' understanding of phonology, semantics, and grammar. The next example is our ERP, event-related potentials, and the FNIRS, which is functional near-infrared spectroscopy, and MEG. These are research methods that can be used to measure infants' brain's activity in response to stimuli like speech sounds, which is phonology, words, which is semantics, or phrases containing different words or markers, which is known as grammar. Now we move on to the milestones in semantic development and grammatical learning. Infants and toddlers can understand words before they can say them. In the next learning objective, we get a glimpse of milestones in semantic development and grammatical learning. Many infants at the age of 4 to 6 months can recognize frequently used words like mommy, daddy, or even their own name. At 12 months, children typically begin to sign words or say their first word. At 18 to 19 months, children typically have a vocabulary of about 50 words. Between these months, vocabulary growth rapidly increases. Some researchers call this increase naming explosion or word spurt. Due to this word spurt, some children learn 40 new words per week, and many children go from having 10 to 20 words to over 100 words in a span of a month or 2 months. Deaf infants learning sign language first sign and have a naming explosion approximately at the same ages as spoken vocabulary growth in hearing infants. Next, we have assessing language abilities in children 2 years and younger. There are many language screening instruments that exist, but there are only a small number that are designed to assess children who are younger than 2 years old. Some of these language screening instruments require evaluations that are done by trained examiners. Others rely on parental reports. The first language screening instrument example is the Rosier Infant Toddler Language Scale. This is used primarily to detect delays in language skills from birth through 3 years of age. A trained examiner conducts this assessment and evaluates pre-verbal and verbal communication through a parent questionnaire and direct observation. The next one we have is the Ages and Stages Questionnaire, also known as the ASQ. This general screening tool asks parents to respond to 6 questions about their child's communication. The ASQ also includes questions about a child's use of gestures and pointing, as well as their receptive and productive language skills. The last one we looked at is the MacArthur-based Communicative Development Inventories, which is also known as MBCDI or CDI. This tool assesses both receptive and expressive abilities in children younger than 2 years of age. Parent reports and checklists are used for this assessment tool. Parents of infants assess their child's understanding of familiar words, actions, gestures, and pointing. Parents of toddlers report their child's production of specific grammatical markers, words, sound effects, and animal sounds. The toddler form also asks parents to list 3 of the longest sentences they have heard their child recently say. The last objective we look at is examples of a typical language development. At the age of 2 years old, children who have an active expressive vocabulary of fewer than 50 words and tend to produce few multi-word utterances are typically considered to have a language delay. Those with language delays are also known as late talkers. These toddlers do not have any known developmental disorders, hearing loss, or cognitive impairment. Some children have expressive language delays only, but others may have a combination of expressive and receptive language delays or have a difficult time following verbal instructions, perceiving phonological differences, and using symbolic gestures. Language delay affects 10 to 20% of 2-year-olds. Autism spectrum disorder, or ASD, is a genetically based neurodevelopment disorder that is often diagnosed anywhere from 12 to 24 months. A tool that studies language and communication in children with ASD is called Language Environment Analysis, or LENA. LENA is used to record large samples of child language in naturalistic settings. This tool allows researchers to record up to 16 hours of audio during infants' everyday activities, automatically and precisely categorizing infant and adult vocalizations. When head-mounted mini cameras and eye-tracking systems are implemented, these technologies let researchers gather and analyze large samples and investigate questions about how language develops in the context of interactions with caregivers or other people.
Language development is very important, even at such a young age. From birth all the way to 12 months, this is where children are listening, taking in all the information, imitating sounds, gesturing by reaching, by pointing, facial expressions, smiling, vocalizing when being talked to, response to their name. This is their way of speaking to us and understanding what we're trying to tell them. Usually anywhere between 8 to 9 months is when some children will start to say mama or dada, start to use a little more of those words. Anywhere from 12 to 24 months is when you start seeing children will be using more of their words, having words between 50 to 100 words by saying mama, dada, yes, no, milk, any simple words that they might be doing. Anywhere from the ages 2 to 3 years old is when they start to follow two-step directions, combining more words together, naming a few more objects, being able to express their needs, what they would like, what they don't like. Anywhere from the ages between 3 to 5 years old, this is when children will follow more of the three-step directions, asking and answering questions, using 4 to 7 word sentences, being able to more express their needs, having full-on conversations with children, with people around them. This is why language is very important even at birth. By reading books to children, by listening to music, continue to talk to them, vocalizing what their day-and-day activities are. This is why language is very important. Assessing language abilities in children between the ages of birth to age 5 is very important. When knowing these signs, it can help further detect if a child might have a speech delay or have any other language concerns. This is why the Center for Disease Control and Prevention, CDC, and the American Academy of Pediatrics, AAP, have issued a revised developmental milestones checklist in February of 2022. They have created this website called Learn the Signs, Act Early. This is also an app that you can download on your phone that have a checklist where you can see if your child is meeting their milestones, if they need help when they need further getting assessed, make referrals, taking it up to your pediatrician for any concerns. Here's some tips for parents and families that can help further develop language for their child by talking to them every day about their daily activities, asking them how they are, how was their day, letting them answer the question, encouraging by imitation for sounds, words, introducing new vocabulary, new routines during the routines or outings, back and forth conversations by reading to them every day. When reading to them, choosing a book that has rhymes, bright colors, different textures, and photos, by pointing out the different words you might be saying to them, by pointing out real versions of the pictures from the books you read, by singing songs to them, nursery rhymes that can have a different pitch and volume of your voice, model good speech, speak clearly, naturally, and use correct speech sounds by describing the different objects by sizes, color, and textures. This can help with comparison words such as hard and soft by playing games with them, following directions, using, as Simon says, encouraging pretend play, by doing a toy phone or having a picnic, building conversations with your child about the different activities you might be doing with them. Asking them questions is a very important one. For example, what do we need to eat for breakfast? What would you like? Letting them also giving them that time to respond to the question that you might be asking them. So this is some of the tips that we have for parents and families who want to further help their child develop their language skills.
Here is a list of our references if you're interested in finding out more information.
Fine, thank you.